Hi, my name is Hannah. This is my medication administration video. My videographer is Maddie and my evaluator is Kristen. Okay, so I have checked my provider's orders and I have gathered my supplies. I have patient here, Mr. Wheeler, today with an allergy to codeine but no other contraindications. I'm gonna wash my hands. Okay, I'm going to start my checks for my medications. First, I have the influenza vaccine, 0.5 milliliters IM, influenza vaccine, 0.5 milliliters, expiration of 2030. Next, I have Colace, 200 milligrams PO daily. So I have a Colace 100 milligram pill, expiration of 2036. And another Colace pill, 100 milligrams, expiration of 2036. And lastly, I have heparin, 5,000 units subcutaneously. Heparin, 5,000 units, expiration of 2030. Okay, so I have checked my 5 rights. I have the right patient, Mr. Wheeler, the right dose, the right route, the right medication, and the right time. Okay, so now I'm going to move outside my patient's door and check again. So first I have the influenza vaccine, 0.5 milliliters IM, influenza vaccine, 0.5 milliliters, expiration of 2030. Next I have Colace, 200 milligrams PO daily. My first Colace pill, 100 milligrams, expiration 2036. And again, my second Colace pill, 100 milligrams, expiration 2036. Lastly, I have heparin, 5,000 units subcutaneously. Heparin, 5,000 units, expiration of 2030. Okay, so I have the right patient, Mr. Wheeler, the right dose, the right route, right medications, and the right time. Okay, now I'm going to move into my patient's room. Hi, Mr. Wheeler. My name's Hannah. I'm going to be your nurse today. I have a few medications to give you. Can you go ahead and tell me your name and your date of birth? Okay, great. And can you verify your allergies? Codeine. Okay, great. Okay, Mr. Wheeler. I am going to provide privacy and wash my hands and put on gloves. Alright, first we have our Colace pill, 200 milligrams by mouth daily. Colace 100 milligrams, expiration of 2036. And again, Colace 100 milligrams, expiration of 2036. Okay, Mr. Wheeler, are you able to swallow for me today? Okay, great. This is your Colace pill, which is a stool softener to help you use the restroom. Water. Okay, go ahead and open for me. Great, thank you. Okay, Mr. Wheeler, next we have our influenza vaccine. So influenza vaccine, 0.5 milliliters IM, influenza vaccine, 0.5 milliliters, expiration of 2030. Okay, I'm going to gather my supplies. It's 0.5 milliliters, so I'm going to use a 1 milliliter syringe, a blunt tip, and a 5/8 needle 25 gauge. Okay. Going to clean off my vial. Okay, so 0.5 milliliters. This is a multi-dose, so I'm going to inject some air. milliliters. Safely recap my needle. Okay, and this is going to go into the deltoid. Going to clean this off for you, Mr. Wheeler. Okay, so this is going to find your chromium process, 2 fingers, and a V right here. Okay. Okay, double checking. 0.5. Okay. I'm going to Z-track. Big stick, Mr. Wheeler. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and lastly I have heparin, 5,000 units subcutaneous, 5,000 units heparin, 2030. Okay, I'm going to gather my supplies. I have a 3 milliliter syringe and a 5/8 25 gauge needle. This is a single use. Okay, 5,000 units is 1 milliliter. Okay, so this is a high alert medication, so I'm gonna have a second RN check this for me. Kristen, could you go ahead and check this for me?
Okay, 1 milliliter, and it's heparin. 5 milliliters is 5,000. Yes, correct.
Okay. So this is going to go into Mr. Wheeler's abdomen. Going to clean this off for you. All right, Mr. Wheeler, this is an anticoagulant that it's going to go into your abdomen area. Okay. Big stick. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So now I am going to leave Mr. Wheeler in a comfortable position. I'm going to assess to make sure there was no adverse side effects. I'm also going to evaluate later, make sure the medications are working. I'm going to document that I had the right patient with the right dose, right time, and right route.